The 5 T's of rabies. Type. Rabies is a viral infection of the lyssavirus genus. Although cases are reported throughout the world, 95% of cases are seen in Africa and Asia, and India continues to have one of the highest rates of rabies in the world. Once infected, the virus will travel to the central nervous system and subsequently replicate in the brain, causing acute encephalitis. Sadly, once a person has symptoms of rabies, the disease is fatal. This is an important point for any traveller to be aware of. Transmission route. Dogs are the most common reservoir of the virus. However, all mammals should also be considered as a potential risk. The virus is transmitted in the saliva of an infected mammal. This can be through a bite, a scratch, or even a lick over an open wound or mucosal surface. The virus will travel through the body to the central nervous system and to the brain. Once in the brain, the fatal encephalitis will occur. This averages 2 to 3 months, but can be as little as a few days or even as long as a year. Treatment and prevention. Once symptomatic with rabies, there is no treatment for the disease. If exposed, a post-exposure regime must be commenced urgently. If a traveller has not had any pre-exposure vaccines, this may include multiple doses of vaccine plus a dose of rabies immunoglobulin. Rabies immunoglobulin is a blood product, therefore carries a risk of other bloodborne diseases. The immunoglobulin may also be very difficult to obtain, therefore it may require travel to major cities or other countries. A course of rabies vaccination before travel is a sensible option that offers protection to nearly 100% of those vaccinated. The pre-exposure course is 3 doses of the vaccine, the timings of which can be found in your respective country's immunisation guidelines. Even the traveller that has received a full primary course of the rabies vaccine should seek medical advice. They will receive a further 2 doses of the vaccine to ensure protection. If someone is scratched, bitten, or even licked over an open wound, they should wash the wound with soap and running water for several minutes, apply alcohol or antiseptic to the wound, cover with a simple dressing, and then seek immediate medical attention. Traveller's risk. The main risk for travellers relates to the location they are going to, the activities they'll be doing, and how long they're going to be there for, as this will increase the likelihood of being exposed. Higher risk activities include running, cycling, and travelling to remote areas where it will take a significant amount of time getting back to a suitable medical facility. Small children must be carefully watched, as they may be attracted to playing with cute, furry animals. There will also be some people that are travelling for research or volunteer purposes and may be working in laboratories or in areas with animals which put them at a higher risk. Take home message. Rabies is a viral disease that is fatal. It can be transmitted by a bite, a scratch, or even a lick. There is no treatment once symptoms present. However, there are post-exposure treatment options if accessed urgently. The pre-exposure vaccination schedule is highly effective at preventing rabies and should be considered. Anyone exposed should remember to wash the wound with soap and running water for several minutes, apply alcohol or antiseptic to the wound, cover with a simple dressing, and then seek immediate medical attention.